Dr. Margaret Ross, welcome back.
Thank you for having me. Our second installment.
Our second installment, exactly. I know. I think the first one from memory it was going to be in person, and then COVID happened.
That's right. That's right. It
Yeah.
was. We're going to catch up and in the studio.
Yes, exactly. Yeah, in the studio that I have, which is always a bedroom.
Yeah. Then you moved.
Exactly.
You escaped the state.
That's true. That's true. We did, and it's funny. Born and raised in Melbourne my whole life, grew up in Northcote, and kind of slowly moved kind of southeast for no apparent reason. And you get used to the weather because you don't know anything else, right?
Yeah.
And then you come up here, and now I'd say we've acclimatized, and it's always consistent. And I'm just like, when people are talking about the volatility in Melbourne, like I now understand how people bring the weather up.
It's true. It's true.
Yeah.
The layers, the 4 seasons in one day. And
yeah. But I think being from there, like there's something quite nostalgic about that as well. Like I kind of like that. And I think in winter, it's nice to rug up and watch a movie, and, there's something beautiful about that too.
Yeah. Or when you're out and you're like, oh yeah, gorgeous day. And all of a sudden then it just like drops.
Yeah.
15 degrees.
Yeah.
You're like, nothing for cover because it's pelting down.
That's right. Yeah, we'll just forget that happens.
This is right.
Well, Marg, I think like we were talking about before the show, we just had so much to talk about, and every time we catch up, we do. That's just the nature of like-minded individuals, I think, which is one thing that I didn't ask you on the show last time, which I would love to hear more about, is actually your personal journey, aside from the topics you're interested in, aside from the research that you're doing. Do you want to tell the listeners just a little bit about perhaps what you do, and also kind of how you moved into psychology, and where the roots were and everything, and just give us the real deep unpacking here.
Gosh, well, it's a funny trajectory. It's not usual at all. I think some people are kind of grow up sort of going, oh, I think I want to be a psychologist, I was thinking about becoming a classical musician.
Oh wow!
So I liked psychology. I really, really liked it, and I enjoyed it when I was studying it in high school. I took it in my BCE, and at some point, I think, in fact, I remember the month. I don't remember the date, but it was sometime in November 1994.
Yep.
Mistaken. It was a very humid day. There was beautiful music playing all around me. I was a sweating, nervous wreck.
Yeah.
And I basically looked down and I held my clarinet, and I was about to audition in front of a guy by the name of Philip Michel, who was at the time the principal clarinet player of the Melbourne Symphony Orchestra.
Oh, wow.
The Conservatorium of Music. And that was maybe 5 minutes before my audition. And I went, I am never doing this again.
Really? Interesting.
Yeah.
Something
and
hit
I went home. I did my audition. I went home. I changed my preferences and went, no, I think I want to do psychology.
Wow.
So that was a big point. That I had always been interested in humans and why we think the way we do. I've always been fascinated by death. That was a journey that happened way earlier. When I lost my nan. My nan died when I was 7.5, nearly 8. So that was a big experience for me. And I think I was always very, very interested in death and why are we scared of it? Yeah, we are scared of it. Oh, I don't like it either. What is that about? And we don't talk about it very well, and at least we didn't in my family. I sort of had some dual fascinations that kind of converged at some point. So, and then I did a degree of psychology at ACU, because it was a really nice small university, and all the lecturers, we were so spoiled. All of our lecturers all had clinical practice alongside their lecturing work and their academic work, which was gorgeous. We had, I remember, an object relations analyst, a Lacanian. We had obviously CBT therapists, REBT therapists, but also existential. It was just gorgeous. This beautiful mix. We were so spoiled. That's sort of where I had my psychological upbringing.
Yeah.
And I went back there for my doctorate. It was my master's initially, and then I upgraded to a doctorate. And That was it was I have very good memories of that. So and then
Mm,
I moved into I knew I was always sort of interested in, the sick and the elderly because it was on that precipice of life and death. And I
mm,
eventually moved into that area, and then I went, wow, uh, we don't have a lot to throw at this.
yeah.
Aside from some, I mean, there's some very really gorgeous existential psychotherapies and meaning centered psychotherapies in the talking therapy realm, and then there's music therapy, art therapy, and so forth, which can be wonderful at end of life, really powerful.
Mm,
Um, and then there's medications, but for some people who don't respond to any of that, we just didn't have very much. So this is where I was psychedelics, I guess, pulled me into the research world. Again, I'd had a bit of a research life at Origin years ago, Origin Youth Health. Um, so I kind of knew about clinical trials. So I've had a very weird, and wonderful journey, and it kind of all converged at one stage.
yep.
Um, Death, psychedelics, psychology.
Yes. It's the
Interesting as
perfect match,
well.
isn't it? It's like you can see
Yeah.
so much overlap there in a beautiful Venn diagram of your life, how that's all just going to come into it. And there, what happened that day when you decided that you never wanted to play clarinet again? Was there some sort of revelation that you had, or you like Tom? After everything I just said, that's what you're holding on to. I just can't believe that though.
It was I was building. It was building.
It was building.
You know, I kind of went, I don't know if I want to do this, but then I did. I was like, oh, but no, I have to really do this now. I'm on this train of these auditions and this and that. And I don't think I was terribly good either. I wasn't bad, but I was from a very small community where big fish, little pond.
Right.
So you kind of celebrated in that way, but I don't think I was anything special. And I actually realized, I thought, God, there's so much more to this. And I really,
Mm,
really loved psychology. And though I'd only really hit that uh, in BCE, but I remember as a child kind of being preoccupied with all these really big questions about, what it's
mm.
all about, and how do we just get here? Hang on. Yeah.
Yes.
Um,
Yes.
and if I am looking at the color blue, is that what you see?
Yeah.
What do you see? How in
Yes.
my perceptual reality, is that the same as someone else's? Not that I was calling it that at the age of 10 or whatever.
Yeah, exactly. Yeah.
I was sort of very
She's got a
interested
bright
in
future, guys.
yeah, yeah. It's and just in the concept of consciousness, I've always been fascinated by that. So,
Totally. I
and
think
so it was, I
I've
think, a
often wondered
really
that.
dawning idea, and then I kind of went, no, I'm not doing this anymore.
Yes, yes. Yeah, I think when you can get enough signs after a while, I think like we discussed last time, like my big moment was in moving from AFL, and I really resonated deep with what you said with that kind of revelation of, oh yeah, I'm actually just not that good. Like, I'm not bad, but I feel like, a bit of a pipe dream perhaps, which is fine. Tough at the time, but something
Yeah.
that you have to accept, I think. But
Mm.
I think one thing that you spoke about there, just this, just being in this state of constant awe about what it means to be alive and what it means to die, and just the human experience in general. And I've often wondered how, we learn about this all the time, just how being a psychologist, you're already going to bring these natural biases to whatever you do. So as much as you want objective truths as to, what you might try to find in research and all that kind of thing, one of the limitations of any kind of survey, I suppose, when you're dealing with people who are interested in psychology, is just their personality constructs, and what we're like as people, and being obsessed with like learning from other people and learning about things. And for someone perhaps who's a little bit more kind of psychologically conservative, shall we say, they're like, oh my god, you're just a pain in the ass, who cares, just go to work. But I can't, like, what does it mean to go to work?
What about?
Yeah.
Yeah, all the bigger questions. And I think that's the thing, the beauty of particularly where I've been in the last 3 years, which feels like it's just been my entire life with um, psychedelic um, assisted therapy.
Mm,
And we did so we've just finished 35 participants, and it was 65 dose sessions, I think 64, 65 dose sessions.
mm,
Most of them I did with my colleague, Dr. Justin Dwyer, fabulous psychiatrist who's also psychodynamically trained, and excuse me. So, but coming out of that, you realize how much it's just been about putting people into these transcendent states, and
mm,
that big question of what's it all about actually
mm.
um, really comes to the fore. And I think we've certainly had multiple experiences of vicarious or um,
Interesting.
on just by virtue of being in the room with it's a tangible and really profound experience,
Mm,
and has left an indelible mark. In fact, every single one of them have left an indelible mark on us and changed us. I think professionally, personally, me, I can only speak from my experience, but it was staggering. Really, I had no
mm.
idea.
Yes.
So when I was chasing those, wow, this is I'm really. I had no idea what I was in for. It was like it was this extraordinary initiation.
Wow. Well, I mean, we've got to dive in. I think with a beautiful segue like that, yeah, and we've got to make mention of the wonderful cup there as well.
Oh yes, my mushroom cup. Yes,
The mushroom cup, beautiful.
yeah, I
Just a bit
bought
of
it
product
at
placement.
I bought it at a. I was speaking at a mycology festival on the weekend, and
All right.
I had some wonderful things there. So it was
You always got to bring something back there. Well,
exactly.
let's have a discussion about some of the recent research that you've been looking at. Obviously, we can't give too much away from what I understand because I think the results are published in October. Is that correct?
Yes, so we can't wait. Watch this space. We're still waiting for our follow up data to come in. We're literally just finished dosing about a week and a half ago. So
Oh, wow. Wow.
we've got a little bit of follow up data, which is 6 months after our second dose. Once we've got that, then we can start looking at um, analyzing it
Mm,
and getting it ready for peer review. So once we've had it peer reviewed, then we can speak to it. But we've certainly got plenty of observations that we can speak to, and I think impressions on how this may move, going forward,
yes.
which
Yes.
is a very exciting time, I think, in psychedelic assisted therapy.
Mm.
Very big leaps.
Oh, wow. Yeah. Well, we're looking forward to it towards the end of the year.
Me
I
too.
think.
I'm aching to
Oh,
talk about
you'd be aching. I can't imagine after 3 years, you just want to tell everyone everything, and oh
it.
god,
Yeah, yeah, it's been
shocking.
amazing.
Okay,
Mhm.
so so basically, one of the first things that I would love to speak about here is
Mhm.
just kind of the differences in what I'm assuming, and I'd love you to speak to this, obviously, in what you're actually trying to find as a result of using psychedelics. Because one of the things that I think is really interesting, especially for the medical profession, is that that entire industry is set up to keep people alive, to
Yeah.
sustain life and prolong life. And I think one of the most amazing things about psychedelics is that there's a really wonderful, when you have these transcendent experiences, there's a wonderful state of acceptance of inevitability that comes through, especially on the topic of death and dying and so forth. So were there any kind of like contradictions there, or things that you didn't expect, or people, even in individual case studies, where people are like, oh wow, I don't view this so much as an issue anymore? And yeah.
I think that's a really gorgeous and nuanced question, and there's so many threads to it. I would say that, as a cultural container, I don't think Westerners are very good at death. And I know I said this I'm pretty sure I was banging on about this the last time we spoke as well. So the problem is we're not prepared for it. When it comes and people have a really devastating diagnosis, no one's ready. No one
Mm,
wants it. This is not, and we can fight it. We can be paralyzed by it. It creates extraordinary despair. So, um, people can come into the study and have, did come into the study with a lot of fear
mm,
or extraordinary sadness about why is my life ending now? This makes
mm,
it's just not fair, and and it's not for it's, but there is a reality here that we're all going to die.
mm.
This is something that all of us have to face at some point. And I remember seeing this beautiful um, discussion about death that Clarissa Pinkola Estes. Have you heard of her? She's amazing, Jungian
Yes, I
Indigenous woman.
feel like it was she's from South America.
She is.
She's passed now, but she kind of
I
brought
think she's
mushrooms into the
still alive.
West. Oh, right, okay.
I think she's still alive, but she did some beautiful talks about this. But she talks about the life and the death cycle. She is Indigenous, um, uh, America, Mexican heritage, and she's got a beautiful mixed heritage. But she talks, the stories, but she says, the life and death is just this cycle that we're just not used to in the Western world, and it's much more accepted in Indigenous society. And we're not good at allowing things to die.
Yes.
We're not good at allowing bodies to die. We're not good at allowing relationships to die.
Yeah.
Or cycles that we're kind of trying to keep them, alive, and like sputtering candles that have got no wax left, and we're trying to kind of keep things. Now, and certainly there's times when we can prolong and improve, a quality of life, but when is our time, and I have to say, one of the really incredible things to witness in the study that we did was that people would come to this realization, oh, yeah, that's right, I didn't do anything wrong. It's just part of, so they can sort of see themselves in the kind of the bigger picture. There's whether it be that big sort of cycle of life and death, or life will go on in some way. I will, my children, or or whatever. It feels like they're part of something bigger, and that there's a lot of quite a few people actually that go, what did I do wrong? What did I do wrong in order to get this? Was it just terrible luck? And often it is. But I must have done something wrong in order to create this in some way. So to have people have these experiences whereby they kind of go, oh yeah, I get it now. It's part of this life death cycle. Enormous burden can be lifted with that realization. And it can be as simple as something in the symbolic. People will often see death in the symbolic in these experiences. Or seeing, life cycles of insects and animals and so forth, and kind of thinking that and going, okay, I'm part of this cycle too. And there's a very powerful realization in these experiences that people will go, it's going to be okay. My loved ones that I'm leaving behind will be okay.
Wow.
This is part of it.
Yeah. I think one of the things I find really interesting, so I think just for context, in terms of what you were actually studying, Marg, was it death anxiety and the potential benefit of psychedelic assisted therapy for that?
Yeah. So it's a tricky one when you do any kind of clinical drug trial. You have to use language that the FDA likes. So the FDA being the Food and Drug Administration. So anytime you try a new medicine or a new device, you have to subject it to clinical trial study designs and so forth to prove that it's actually an effective treatment, or more effective than X, Y, and Z, or placebo. So that's the best gold standard. So while, yes, I was looking at things like death anxiety and I guess what I would call existential distress, they don't like that because it's a difficult term to define and operationalize in a way that's measured with numbers. And unfortunately, that's kind of the main way that they look at these things. But we had to look at things like levels of depression and levels of anxiety associated with having a life-threatening illness. So and it's even depression and anxiety. I mean, what's that? These
totally. I was about to say that too. Like, what does that mean?
Exactly. I saw this great study recently. It was fabulous, and it was from, I think, University of Liverpool. It was Liverpool. Anyway, I'll send it to you.
Yeah.
We said they did all these systematic reviews, and they found that diagnostic labels were absolutely meaningless.
Well. I'm happy there was funding for that, for all intuitively.
Exactly. They're just like diagnostically meaningless and blah, blah, blah. So, and all the reasons for that, because there was such variation. And so, failed to take into consideration things like, personal traumas. And so, I was like, yes, that's out loud.
That's hilarious. Yeah.
But,
I'd love to read the abstract on that. Meaningless.
Meaningless. Yeah. That was the main bullet point of the presentation. But so we have to sort of say it's depression and anxiety. So it's a transdiagnostic study looking at levels of distress, really, but primarily depression, anxiety, in people with terminal illness. So
terminal illness.
Really, so sort of looking to see if psilocybin assisted therapy would reduce levels of distress as measured by, depression measures and these anxiety measures. So
Yeah,
yeah,
yeah, yeah.
that
Okay,
was
cool. That's cool. Because yeah, as far as I understand, there actually aren't too many ways to operationalize some of the things that you and I talk about so often. When we catch up and so forth. And yeah, as you said, existential distress. I didn't even know. Is that an inventory that people can fill out, or is there something like that for existential
I think
despair,
they've
distress?
yeah, so because it's not diagnostic, because it's not been an accepted diagnosis in things like the DSM, uh, which is the Diagnostic Statistical Manual for mental disorders, which is
Mm.
kind of like the psychology Bible. Even though we've just they're meaningless.
Yeah, it would
They're
just been
salesmen.
yeah.
um, so obviously, look, when you're looking at things like a really tight uh, study design where you have a clinical trial and you're looking at a trial drug. And this is an interesting one because it's not just a trial drug, it's also a combination. So it's trial drug
Mm,
plus treatment, so it's therapy as
mm,
well.
mm.
But you have to have parameters that you can measure very robustly. So they're looking at checklists of depression, checklists of anxiety. Existential distress is such a broad
Mm.
and subjective kind of category, as is depression, but they have agreed upon definitions of what constitutes depression and anxiety disorders. So
Yep.
that's sort of where we get the tricky thing is how you quantify that in a checklist anyway. I mean, which none of us really kind of think captures it in any kind of meaningful way, but it's enough that the FDA will go, okay, well, it's reduced it by 50% or what have you, which is why we decided to do a mixed methods design. So we've got a qualitative interview as well, because
Yep.
it's so important to be able to capture people's experiences. I
Mm.
mean, how on earth can a checklist capture a psychedelic experience
Right.
in its entirety?
Yes. Yeah. Oh,
Um,
that's great. That's so
yeah,
great. Because yeah, you're exactly right. Things like surveys and stuff, and they're great because we can measure the data, but then qualitative analyses with case studies and
yeah,
videos and watching people. We had Dr. Chris Kerr on my other
yes,
podcast with my mate, Paulie, and Paulie be so keen to meet you and interview you as well, Marg. I know he would be. He was talking about some of the studies that he done, and he did. I'm assuming he's probably done a range of them, mixed methods and so forth. But the part that really struck me, especially when I was reading his book, were the case studies. Hearing these people talk about their experiences and how death in itself, if you flow with it, is psychedelic to a degree because you're forced to
yeah,
reflect on all the things that a psychedelic just kind of opens the door, shoves you in, and closes it behind you. you know, um,
absolutely.
but
Yeah.
it is amazing. And there was a question that came for me when you were talking before about some of the meaning that people are able to cultivate after these experiences. Um, Irvin Yalom has spoken often about in his books. For everyone, I talk about him all the time on the podcast anyway, so the listeners
He's
know
your
him anyway.
crush.
Yeah,
I
exactly.
totally, I'm with you on that one,
Yeah,
100%.
massive, massive man crush. um, but he talks often about this idea that whilst there isn't a whole lot of data to prove it or whatever,
Mm,
um, he's really led to believe that there's like a really wonderful inverse relationship between death anxiety and your life satisfaction. So the more happy you are with the way your life is played out, the more fulfilled you are, the less anxious you are, and the more ready you are able to approach that next step.
mm,
And he would speak often about his group therapy processes and working with people who are dying and all that sort of thing. And one of the things that really struck out to me was people were able to find meaning with their life living on by showing people how to die well. So even
yeah.
they could bolster their ego in a really lovely, healthy way, even on that last part to leave us all for the next life, so we could do the same. And I'd love for you to elaborate on some of the meaning that people were able to cultivate from these experiences.
Yeah, it's funny that you say that because we literally spoke with one of our participants yesterday who has dedicated significant time now to um, there was a group who asked her to come and speak about her experiences of dying, and dying well was her
Mm.
choice of topic and how
Oh,
to do
wow.
it. And,
Wow,
just
that's
an
weird.
incredible human. We've just met the most beautiful humans. We feel very, very extraordinary privilege. But anyway, so
Mm.
the meaning, I guess, that has come forth has been so. I think for the ones. By the way, this is for the ones who have really found a way to engage meaningfully with what
Sure.
happened to them. To say that it's for everyone is not the
Sure.
case. So I need to put that caveat in there. But I think in terms of meaning, that just that ability to kind of go, you know what, I'm not dead yet.
Mm. Mm.
And I can, uh, um, this is an important point to make here. People who, and I think people who have chronic illness would probably understand this as well. Certainly, people who have terminal illness can feel very reduced to a set of symptoms and they feel very dumb to. They're often off to appointments, they're getting chemotherapy, they're getting it's their whole life is dictated by their illness. So they can often lose a sense of who they are and their identity just becomes the cancer or
Yeah.
the whatever the diagnosis motor neuron. Um,
Mm.
can impact their relationships as well. So their whole identity then and their discussions with their loved ones all becomes about symptoms and how to manage that and their fatigue levels and so forth,
Yes.
what they can do, what they can't do, and how sick they feel, and putting care around that. So there's enormous grief over who they are, who they were. Um, their relationships have kind of moved from loved ones into kind of carer patient mode. So they really lose contact with aspects of themselves.
Mm.
One of the most incredible aspects, I have to say, that two actually, is this reconnection to self. They remember who they are. That's right.
Mm.
That's right. I love this. Oh gosh, because they can be so battle weary from their illness. They just start to they just see themselves sort of being as this ill person, and it's
Mm.
I used to be this person who was happy and I love this and I love doing that and I can't do those things anymore. But all of a sudden, they remember. There's a lovely remembering that goes on.
Mm.
So, and finding meaning, even if they have a short time, and what
Mm.
they're going to do with that time, and that seems to be accompanied by this lovely surge of eros. And when I say eros, I mean in terms of vitality
Mm.
and creative process, and it can be the sensual and it can be the sexual. We've certainly seen that as well, and it's very welcomed
Yeah.
by our participants, that they can have these feelings again in this body that's really quite tired and doesn't feel well, and it's been s- fighting cancer, or all of a sudden they can feel this surge of creative process, like, oh, okay, I'm going to make, that's right, I'm going to enjoy that again, I'm going to do this, and
Wow.
looking at what they can do. And it really shifts their tiller into, oh, okay, I'm preparing for the end, and that's terrible, and I'm scared of that. To, okay, that's coming. What am I going to do today? How
Mm.
am I going to enjoy this moment? And so there's some lovely kind of stilling in the process of, I'm not there yet. I'm here
Mm.
now. I'm going to do some art with my kids. I am going to go on that beautiful hike, and I'm going to go. And have that trip while I can. Okay, I can't do this and this and this, but I can do that.
Mm.
So
Mm.
bringing, yeah, because I feel so disconnected from what is meaningful to them, because
Yes.
they've lost who they are. Seeing people reconnect with themselves has been extraordinary, and an extraordinary uh, privilege to
Mm.
witness that right in front
Wow.
of us, and that's been really quite profound.
I mean, that reconnection to Eros, I think, is something that is really important in this conversation. And there's a lot of, I mean, the whole kind of baby boomer idea is that after having witnessed so much death, there's this surgence of sexual vitality. But even like hearing myself say that, it kind of reduces the spiritual significance down to just an evolutionary process. And I don't want to do that. Like what I'm really hearing from you speak there is that sexual vitality that comes forth from these transcendent experiences is not so much because I'm horny and I'm keen to have sex, but it's like I'm
Yeah.
almost keen to find myself through my sexuality in a way or something.
Or and just all of a sudden feeling, hang on, it's so beyond
Mm.
the sexual aspect. It can be the sensuousness of
Yes.
of of um enjoying movement in their body,
Yeah.
enjoying yoga, really feeling
Mm.
into deeper layers of self. Also, kind of finding a vitality in creative process. I really expand that definition of eros, because we often think of sex or
Love and
yeah, and but to include that of vitality, curiosity,
yes.
vitality. There are these aspects to people that become very like, wow, that it's enlivening, and
Mm.
to see that has been gorgeous. We had a situation where we had a very young participant who unfortunately died between her first and second dose, uh, um, which was sort of not unexpected, but it
Right.
was quite sudden. And it was, we remember speaking to them after the first dose, and all of a sudden it went, "My, I hope I've just got in me to do another adventure. I just want one more adventure, even if it's a
Wow.
bit of a car trip or a this or a that, or and remembering this kind of feisty
Oh, yeah.
person that they
Cool.
were,
Cool.
which was beautiful, and throwing off some old, ideas about themselves that were no longer serving them, um, and also very much looking forward to the second dose to see
Yeah.
what that was going to bring. And yeah, and unfortunately it didn't make it, but took that feistiness into their dying process in
Yeah.
so far fighting it, but just going, I'm going to be okay. I can do this.
Mm.
Um, so
Wow.
uh,
Yeah.
yeah, the eros and the vitality, and I think um, it's something I'd love to write about, actually, because it's just seeing people come back to life. They
Yes.
that 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 kind of feisty, not in that way, but very very vital is the word.
Totally, totally. Very, very childlike almost, that idea that, oh, this is a giant playground. This isn't a place of, this is a deeper, more philosophical conversation that I'm sure you and I will have eventually, Mark, at one point.
I know, and
But it's
and
great.
look,
But
they still hate that they still like, I don't like that I'm dying, but I get it.
yes.
And in the meantime, I'm going to play, or I'm
Mm.
going to do this, or I'm going to. Um, there's something about reclaiming that time,
Mm.
that it's
Mm.
not just a biological process towards the inevitable terror of that's it.
Yes.
Um, and it's not so preoccupying. They can bring their mind to other things. They're not so gripped by it, or they're not so
Mm.
arrested by that they can
Mm.
kind of go, actually, no, I want to do this today. Actually, I
Brilliant.
think I'll read a book. I haven't done that in the last how many years.
Mm.
And so seeing them reclaim. There's a beautiful poem by Derek Walcott. I may have said it the last time we met.
Say it again, because I can't remember. And the reason I do the show is because of me. So sorry, listeners, but you know the drill.
I love that. It was so,
Pretty
you're so
honest.
honest about it. Good for me.
Yeah.
But hopefully I'm not going to muck this up. It's a free translation. Off the top of my
Yeah.
head,
Yeah.
it really resonated with a lot of our participants when we said it to them. And there's like this poem, which is called "Love After Love," by Derek Walcott, and it says, the day will come when, with elation, you will greet yourself arriving at your own door, in
Mm.
your own mirror,
Mm.
and each will smile at the other's welcome and say, "Sit here, eat."
Wow.
And you will love again the stranger who was yourself. Um, give wine, give bread, give back your heart to itself. Um, to the stranger who has loved you all your life, whom you have ignored for another, and who knows you by heart. And that is,
Mm.
I think the last bit says, take down the love letters off the bookshelf, and peel your whole image from the mirror and sit and feast on your life.
Mm.
And that's where they're left. It's
Wow.
the profound reconnection to self, when the first thing that you lose when you are told you have a terminal diagnosis is you start to lose aspects of yourself. People call it death by a thousand cuts. I've lost my role. I've lost this. I've lost my future.
Yes.
So to return some part, or to return to that part that feels like it's home, is probably one of the most profound things we've seen.
How could you want anything more in life than
Yeah.
that? You know,
Yeah.
that's amazing. The question for you, Mark, do you think
Mm.
that, and I'm not taking anything away from people who have had these diagnoses, obviously.
Yeah.
I wonder sometimes whether or not life in terms of the way we live it, is that kind of death by a thousand cuts, where we do slowly kind of lose little aspects. Because part of what you were saying to me, I'm always in two minds when I'm interviewing people and having chats with friends, right? I'm listening to what you're saying best I can, and then my mind is a million miles over here trying to put other associations together because I can't figure that out. But when you were talking about eros before, and the need of vitality and sensuousness, so much of our ideas around religion and spirituality are very much ingrained in the logos, the truth, expedience,
Yeah.
discrimination, from a technical perspective. And if that's not balanced with vitality, it's that polarity of doing but no being.
Yep.
And
Yeah.
one of the things that you made me think about there when you were speaking about that poem was, even just in my own life, I've seen how there is a lot of fulfillment that comes with progressing and doing things and achieving things. But if there's not also that balance and constant reflection with the nature of what it means to be Tom, and dancing and playing and creating and laughing, I could see myself, and at times have, losing myself as well.
Yeah.
So
Same.
do you
And
do
we
you think that expands beyond just having a very acute diagnosis in life?
Absolutely. Because we can move into rational supremacy, and there's no way to live. It's so cerebral, and it's boring, and it's driven, and it's exhausting, and we're always trying to eke the last few drops out of our productivity, and it's a
Yep.
garbage way to live. At the same time, we're completely hedonistic kind of lives either, because then it can be devoid of meaning. So
Sure.
you're right. There's that balance that we need. But I remember saying this, and I said it not all that long ago. But my hope is that we can look at how this may have a place, just for life transition, and just to remind
Yeah.
us actually about that, the bigger picture. We can get caught in that 9 to 5 treadmill. We can get caught in the productivity. We can get caught in the goals, and then all of a sudden you get a devastating diagnosis, or something happens, or we lose a relationship, or we something, the wheels fall off. And I had, my patient has said to me, during the trial, she said, I wish I didn't have to wait till I was nearly dying to do this. And you go, you're right. So for me, I'm really wondering about how this kind of could look. And again, we're talking about something that has been done for centuries.
Sure.
So I said this on the weekend. People have sort of said, "Oh, will you come and talk about your work and how that's new and it's exciting?" Well, this is not new. What I'm doing is not.
Yes.
What I'm doing has been done for thousands of years, and it's been done in Indigenous context and ceremony and societies that understand the use of spiritual healing, even though that word has been so bastardized over
Sure.
here.
Sure.
But to have a visionary, to carve out time to really delve deep into one's experience of themselves, their relationship to themselves and the relationship to others, and also the planet, and also to life and what that means for them, is a real deep dive. And we're not great at that in Western society. So I would say this is a re-emerging. I'm
Yes.
hoping, and it's certainly an emerging into Western medicine. It's like, what is that going to look like? Because part of me hopes that it's not just for people who feel completely broken
Yep.
or who are just, at the end of their life, but that it could be for people who are just seeking how to move through this, who want to know more about themselves, who for the attainment of for some kind of betterment of can we use this to achieve kind of a higher aspects of who we are and
Mm.
how we can be.
Well, that who we are aspect is wonderfully fascinating because
Hmm.
there's a paradox that's emerging there. Like a reconnection to self is simultaneously a reconnection to a greater force or a connection to the world or the universe, is what people would say.
Yeah.
What's that conversation been like when you're speaking with your participants? That kind of awareness that now because I'm so much more connected to who I am is not this object, materialistic thing I thought it was, and perhaps now it is just a thing that moves with everything else. Yeah, that would be a fascinating conversation, I imagine.
And they're difficult conversations insofar as they're difficult to reduce to words.
Yes.
It's
I certainly butchered that, so that was perfect
no,
example.
no. But you've actually brought it to a really important discussion, which is it's hard to discuss.
Right, exactly.
Because we're talking about deeply visceral experiences and ones that also rest in the symbolic.
Mm.
So I was listening recently to an eco philosopher talking about the fact that we've really lost touch with our we've lost touch with the natural world, but also we've lost touch with our symbolic language. We're not good at that anymore, and this is what psychological assisted therapy kind of demands
Yes.
of us it's like, I can't put words around that. I know it was very, very important, probably one of the most important things I've experienced. How do I put words around that?
Yes.
And one thing that we sort of say is that we'll get a narrative, we'll talk about it a little bit. We don't want to get too talky about it because then we move into logic and then we just move away from the experience.
That's a great point. Yeah.
And that's the work of integration. So it's but it's actually a really important question that you have, because it's like, how do we discuss it? And that's precisely the answer is, well, we can discuss it to an extent.
Oh, wow. That's amazing. That's such a good point, because we do, and I do it massively, talk it to the point where it's not that thing anymore.
Well, it just becomes an idea. And I think, we can rob ourselves of that, but that's the way we're taught. That's a real problem. It's like, can we sit with those visceral feelings? What does it feel like? Do I have to keep thinking about it? Or can I just feel it? Can I get in my body? Can, doing things like dream work, what's the, or, understanding the symbols of what's come up for you in the psychedelic experience. And rather than concretizing the metaphor.
Yes.
Just kind of go, okay, what would that? And listening to things like story and metaphor, which can speak so much more than the cerebral and the logical. So it's only like 12 o'clock.
Yeah, that's it. That's exactly
where
right.
We are.
I know. But that's such a great point, isn't it? Like, we know that all the time. Like, a picture paints 1,000 words, and I really must integrate what you've just said into my life.
Well, I think one of the things that's really, I had this exquisite experience of a participant who was in peak experience, and it was just they were just sobbing and sobbing, and just held my hand and just said, I'm just in a state of grace. I'm in a state of grace, and just that feeling. And and me and my wisdom said, "Oh, what was that like?" Afterwards, she said, "I can't explain it."
Yes.
But what it felt like, except it was, and the transcendence an interesting one. It's an interesting space to reside in, because you can feel extremely small and insignificant, but at the same time, everything. So logic can only go so far.
Yeah.
With these sorts of discussions.
But you're right. But art takes us just to the point where if we went any further, we'd be in that state. That's why I love art so much about art. Rumi said, I think it was Rumi, it's one of those Churchillian things where everything was a Churchill quote or anything was a Rumi quote, But it's that, are you a drop in the ocean or an ocean in the drop?
Yes.
One is so isolating. And the other one's very, very connected.
Yeah, yeah. And those states of awe, like, and I love the idea of, so when we talk about things like integration, um, part of what we do is actually get people to see if they can revisit or re-access the visceral experience of that. And one of the ways we'll do that is say, go to the natural world, go and see a large body of water or a massive, like Canyon-esque kind of beautiful scene, because they're often so big. Or, art, same sort of
Yes.
thing. It's so big and so that we don't have any, like, our brains aren't set up for it. So it sort of boxes us into this state of awe
Yep.
because we don't have a response at the ready. So this is why awe is so good for our brains, because it kind of then forces you to come up with a way of kind of making space for that. So there's an expanse and a depth that comes with those experiences of awe, whether it be, something gorgeous in the natural world, or art, or something simple that just, it's so arresting that it's just not usual.
Yes.
And
Yes.
this is an experience, and it can sometimes be terrifying. And
Oh,
it can
yes.
be beautiful. It can also be like, oh, I don't know how I feel about this. I have a picture that I use sometimes in my talks of a woman like scaling a fence, and on the other side of the fence is just the cosmos.
Wow.
She doesn't know what she's going to see. She wants to see it, but she doesn't know what she's going to see, and how there's nothing to catch her. It's just the enormity of it all, and
Yes.
it's got no bottom and it's got no top, and it's
Yeah. Yeah.
breathtaking,
Yeah.
impossibly beautiful and terrifying. And
Yes.
that is awe.
That is awe.
Yeah,
That is awe, isn't
that is
it?
awe. That is transcendence. So it can be all of those things. Sometimes troubling. This is the thing. People can have sometimes really quite deeply troubling experiences in the psychedelic. The blackness or the nothingness, and what is that like? And
Yeah.
we really actually encourage it insofar as, because you go into it with curiosity rather than sort of retract. If you can go and not make friends with it, but if you can kind of go and sniff it out and roll in it, and, what is that? All of a sudden, your curiosity takes over, and
Yeah.
the anxiety starts to abate.
Yeah. Isn't that interesting? Anxiety is it's just that, oh, hang on, we're there. But when you actually do it, like, oh, okay, well, there's no need for that kind of mental projection of, simulating what that could have been, because now you know what it is. So that simulation's gone.
Well, all of a sudden it's curious. Like, I don't know what this is. No one will understand this. What
Yeah,
is
that's
that?
interesting.
Wow,
Yeah.
So that becomes the focus. Not that, oh God, I could die or be annihilated, but to sort of go,
Yes.
oh wow, oh, it's this, and oh my God, and often this happens in psychedelic experiences, that before people have those really quite big sort of transcendent or mystical type experiences, they're often prefaced by quite a dark experience.
Yes.
Before it bursts into the numinous, I think. So, which is why part of our preparation is, trying to sort of say to people, listen, there's nothing to be feared here. This is all, symbolic aspects of you, and you've got every right to know why it's there. So get interested in it, sniff it out. If it's black, go in. If it feels like you're dying, let yourself die. So you're not actually dying, but go into it. And that's when you can really see some quite extraordinary things emerge.
Yeah. Speaking of awe, it's a couple of experiences, not including my psychedelic journeys, but just kind of every day. Well, not every day at all either. I can think of two was when you were describing, or one was when you said Canyon-esque, when I went and actually saw the Grand Canyon, and I was not preparing myself for awe at all. I was like really hungover. Like I was like, oh yeah, I'd be keen to see it. We're driving to Las Vegas, may as well, Hoover Dam, we'll do all that kind of stuff. And it hit me. Like I just walked up to this thing, and the immensity of it was just terrifyingly beautiful. And I couldn't believe it. And in that moment, I immediately went back to the night when I saw the Northern Lights in Iceland. just on this
Wow.
night
Yeah.
where, it wasn't really much going on. There's a bit of green flickering going on, and there was just kind of like a break in the cloud, and we all lay down. I was doing a travel trip, and we kind of all lay down on the ground by a lagoon, freezing, and this kind of break in the cloud slowly approached us, and then all of a sudden, purple light was
Oh,
dancing through the green and everything, and I couldn't believe it,
wow.
and I think for so long I've been trying to, I've written blogs about it, I love to write,
Yeah.
but what you said to me today has really struck as like, maybe you don't need the words, like just have that feeling and that can be enough for you, you know?
Images and revisiting the feeling.
Mm,
Yeah. And,
mm,
and music will get you there as well. To a
yes.
certain, so images, symbolic, um, but yeah, I'm interested. How have you accessed that again? Have you felt that since?
I mean, I
If you want to
it's
speak to that, I'm just interested
oh
because I
yeah,
can
of course.
so many
Yeah. I'll speak
categories.
about anything.
Yeah.
More than happy to speak about it. Or for me comes through art now. Like I
Yeah.
think there's probably a little bit of logos that come, a little bit of rationale that comes through it. Anytime I see a Van Gogh painting, I'm really heavily reduced to not full blown tears, but teariness. I think. But and again, the
Yeah.
context of that is just who he was in his life, and just be such a beautiful human being, and be so depressed and suicidal his whole life, and completely invalidated. Um, Breath work
Yeah.
gets me there a lot. As you know,
Yeah.
Siobhan's a breathwork meditation teacher, and
Yeah.
it is amazing what that experience can bring out. Just profound, different perspectives and awareness with things, even down to the like my parents do it, my family do it together. My dad did it once, and I know he won't mind me saying this. Um, his first experience was great. It's like, oh, this is great for my walking. I feel, it had a very physiological, beneficial experience.
Right.
The second
Yeah.
experience was really sad, and he doesn't give too much away. The old man, and
Yeah.
he's like my best mate. So,
Yeah.
but he was crying, and we all kind of asked him what that was about because there's an integrative experience at the end of it. The way Siobhan will run the sessions, very much so. And he said, there's just been so much suffering on the news, and I didn't know that had affected me as much as it had. And my dad comes from a very particular style. He's much more kind of open now. He's not necessarily stoic, but that was just really interesting to see from my dad.
Yes.
That
Yeah.
would not have been something that I could have paid him to say, put it that way.
Yeah. Yeah.
But breath work gets you there. It's
It
amazing,
really does. Yeah.
Mm,
Yeah.
mm.
Um,
So
um,
so yeah, breath work is phenomenal. But for me, it is always in the art. When I'm reading great literature, there's something about the way that certain masters can write experiences that we've all experienced, but those words in particular are just bang.
yeah.
I love it. I'm addicted to that feeling. I really do believe that I'm addicted to that experience of awe.
And
For better or
we
for
can
worse.
we are hardwired to experience the sublime. It's just where you find it. And I think you know, I mean, I'm like you, poetry. I think I
Mm,
am oh
yes.
something that lands, it just blows you away and
Mm,
can be extraordinary. And music is a big
music.
one too. But breath work is an important one actually that we're seeing more and more of how that can be used very powerfully to integrate people's
Mm.
experiences.
Oh,
Um,
that's interesting. Yeah. So it's
yeah.
like a less intense or they're more in control. So they're more willing or
Well, I mean, when I say it's not really anything new insofar as look, Stan Groff, the
sure.
whole breath work, and I mean that was his work that happened after they couldn't do psychedelic
Yes.
research because of the Controlled Substances Act, which then sort of caught on like wildfire in most jurisdictions. So
Mm,
he then did holotropic breath work in order to induce psychedelic type experiences just with breath. So
mm,
and one of his key ways that he operated, which was really fascinating, was that if somebody had a bad trip, so-called bad trip, they had a really
mm,
challenging experience, he'd get them straight in there
mm.
again. So it wouldn't
Wow.
be
Nice.
avoided or not talked about or whatever else. He'd take them back there and he would work them through. So there were threads that were,
Brilliant.
kind of go back to that blackness. Okay, let do this again. again, undertrained and, with kind
Sure.
of people qualified to do that, and in those circumstances that were appropriate to do that.
Yes.
But so I think, but breath work was a really powerful way to get people there. So for us, part of the integration is that, get to the natural world. Visiting art,
Mm.
having music. We actually give them the playlist that we provide for them
Mm.
during the psychedelic experience. But then breath work has really started to become a very tried and true method of being
Wow.
able to then provoke similar experiences for people, and they can re-access those states that they felt
Mm.
during the
Mm.
dose sessions with us. So yeah, but it can access you in a whole other way.
It really can. And people are, uh, tying off loose ends with deceased loved ones. And, one of my
Mm.
best mates did a breathwork session, and
Wow.
I didn't know this about him, and he said, and he was bawling his eyes out. And this is a guy that does jujitsu and he does CrossFit, and
Yeah.
and he's like, I met my dad, and I shook his hand, and he said it was
Yeah.
okay, and that was it,
Oh wow.
just from breathing, and
Mm.
I just love that again, because it speaks to what we discussed previously, in that he didn't say much,
Mm.
and he didn't need to say anything. It's like, I met my
No.
dad. I'm getting teary thinking about it too. I met my dad, I shook his hand. He said I was great. I was okay. And that was it, and to see, Petey just, crying like that was just amazing. And
Yeah.
Siobhan's wonderful the way she does it. She's not like you and I, blubbering messes over here. She's really great at holding the room. And she was
Yeah.
like, amazing, you know.
Yeah. That's
So,
wonderful.
but it is amazing. It really is amazing for that.
I think the idea of it just all of a sudden we can access ourselves in a whole other way. I don't
Mm,
think there's anything. It's funny. We had this. It was a lovely participant who really kind of, no, I'm not a crier. No, I'm not. I don't do that. Blah blah. And I think even just beginning the idea of therapy sort of started opening
right.
up. And then after the experiences, partner said that they were much more accessible emotionally to them,
Right.
which was a great
Yes.
side effect of them. And in this sort of lovely sort of jokey sort of spirit, said, I think I need to go back to being that, kind of stoic.
It was easier.
Really? You sure you want to do that? And he's like, I don't think I
Yep.
think I can. So
Yes.
yeah, and it was that perspective of, actually, I don't need to be that stoic
Yep.
person that doesn't get affected by anything anymore.
Yeah. Yeah. There's no utility in it, really.
No, but it's an idea that it's weak, and
Yes.
that's something
Yes.
that we have to outgrow. We're
Definitely.
getting better at it.
Yeah.
People like, I say our parents' generation, that was you don't cry and you don't show
Mm,
weakness, and it was socialized out,
right.
particularly of males.
For sure.
We
Yeah.
did terrible damage with that.
I know.
Terrible
I know.
damage. So, yeah,
Marg, we have to cut it. I'm sorry.
we do.
I know. Yeah. But we've got another one coming up in October. So what
We do. We
we'll leave
do.
everyone on a cliffhanger, and then they'll just have to listen to the third episode come October.
Yeah, absolutely. The third installment.
Third
Thank
installment.
you for having
Always.
me.
Of course. Of course. And just thank you so much for bringing this conversation to Australia. So I think it's big in America, or it's really starting to shift in Australia. But the part that you're playing in this for bringing it here is just absolutely undeniably important. So thank you so much, and thank you for being such a wonderful friend too. I
Thank
love
you.
it. It really benefited me as an individual. So
Thank you so much. Thank you very much.
beautiful, guys. Thank you for listening, and I will talk to you very soon. Bye bye.